Hello, everyone. Jerry Tabbitt with you again for another edition of Military Minutes and a very special show for you today. We've got two people that are doing a lot for the veterans here in our area. First of all, Craig Seacrest, who is the Director of Business Development over at Emerald Coast Behavioral Center.
Yes, sir.
And Mel Bruce, now Mel, your title is about this long, but I'm going to try and get through it. It's Licensed Mental Health Counselor, Military Resilience Center.
Yes.
Okay, I passed that. Anyway, thanks for coming in today. We want
Thank
to
you for
talk
having
about
me.
several things that are going on. First of all, a lot of people still don't realize that at Emerald Coast, you dedicate a lot of your beds, 30 of them, to military members. Tell us about that.
Yes, sir. So, Emerald Coast Behavioral Hospital is an 86-bed inpatient acute behavioral health facility. So what that means is most of the people that come to our hospital are in crisis. And what we are wanting to do is get them out of that crisis mode. So we're kind of like the ER of the psychiatric world. So we're trying to get them stabilized and back to their normal, their baseline. And then from there, continue on with that treatment and that help, out in the community. So Emerald Coast is 86 beds, and like you said, 30 of those are reserved for we call it our military resiliency unit, and we serve active duty service members on that unit only. So they have their own unit, and they have dedicated doctors, therapists, social workers, nurses that all have some type of military experience, military background to understand what they're going through and to relate with them and everything. So
and then the actual veterans themselves, they come in and they go in with the rest of the general population, and you take care of them also.
Yes, sir. So when we first started the program and we were building it, we had veterans and active duty, on the same unit at times. But it is so popular. A lot of times we do have a waiting list because Mel and her team do such a fantastic job of treating our service members. That unit stays pretty full. So we had to reserve that for our active duty service members, and we really get them from really all over the world. I mean, we get them from Germany, from Korea, Afghanistan, wherever it may be, and then all over the U.S. as well. So we do have, because of our experience serving our military members, we treat a lot of veterans as well, and they are housed on our open adult unit.
Now, Mel, you got a tremendous job over there that you're doing, and you're doing such a great job, but it's so varied. I mean, you have ones with PTSD, you have TBIs there, you have some of them that are just having physical problems that they're going through, some of them marital problems. What are some of the things that you see are more common than anything else at your military readiness center there?
So for the most part, what we see is a lot of post-traumatic stress disorder, whether that be from childhood trauma or combat exposure. We also see a lot of depression, suicidal ideations, and we have a substance use track as well. So we see a lot of dual diagnosis patients.
And a lot of people don't realize, we were talking about this before the show, that you're just not seeing the young men and women that are coming in from the battlefield. You're seeing generals, you're seeing colonels, because everybody has certain problems.
Yeah, we see people who have, been out of boot camp for 6 months, and we see people who are nearing retirement.
Okay. And meds, this is one of the most important things I think we can talk about. We hear of all these different medications that are coming out. And I know that you don't use them over there, some of these, but state of Florida will take care of them. The brand new one that was just released for use with this is called Ketamine. How is that going to help? It just, to me, seems like another pill that you're going to give to this individual and say, okay, take this pill and you'll be fine.
So ketamine is really interesting because there were a lot of studies on what we call psychedelic-assisted psychotherapy in the 50s and 60s before those sorts of drugs became used recreationally. So doctors were prescribing their patients LSD, ketamine, hallucinogens that would increase a sense of introspection for their patients. And with ketamine specifically, it's been used for mood disorders, depression, anxiety, and it's been seen to have really rapid, long-lasting effects. A lot of the time, ketamine-assisted psychotherapy is in the form of intravenous ketamine. The VA is actually just coming out with a nasal spray called S-ketamine.
Wow.
That's a derivative of ketamine that can be used. And it is typically reserved for whenever that patient has kind of exhausted all of their other options for treating depression. So maybe they've been through the electroconvulsive therapy, the some of the other therapies that we do at the hospital as
Sure.
well. We use TMS over there, the transcranial magnetic stimulation.
So it's something then that just don't get them a prescription and say, here, take this pill every day and don't worry about it, you're going to be fine. That's what's good. The other part of it now is becoming more and more common across the country, and I don't really know how much the active duty and veterans are being involved in this because of the legalities, but medical marijuana, what's the status with that as far as treating veterans and active duty?
Active duty military members are not able to
Okay.
utilize medical marijuana because they, do get drug tested
Sure.
within the military. Anything that is not approved by military doctors, which medical marijuana is not, they're not able to utilize.
Okay. Well, these are two things that are coming out, and it's really amazing. And the counseling that they go through over there, it's not, you do a lot of one-on-one counseling, don't you?
Yeah, absolutely. And we have different treatment modalities that we tailor to the specific patient's needs and symptoms.
All right, Craig, if someone out there viewing this and listening to it and say, well, I think I need some help, what should they do to maybe get started with you over there at Emerald Coast Behavioral?
Well, the first thing they can do is they can visit us at emeraldcoastbehavioral.com and go to our website. We have all of our program information, breakdowns of the therapies that we offer, the different units, the insurances that we accept and cover there. Basically, we take any type of insurance other than straight Medicaid. So, we can, if we aren't in network or don't have a contract with your insurance company, we can always do a single case agreement. And, the main thing we want you to do is get help. And that's what we're here for, is to provide that help for you. The other thing you can do is if you've done your research or you're ready to get help or you need help right now, you can give us a call at 850-763-0017 and ask to speak to our admission department. And what they'll do is they'll schedule an appointment to come in and sit down with one of our assessment specialists, and they're going to kind of find out what's going on with you from A to Z. And we just want to make sure that you're the right fit for the inpatient unit. If you don't need inpatient hospitalization, we have several other steps that we can refer you to and get you that help that you need, because we want to, hopefully prevent you from having to, come inpatient with us. We have an intensive outpatient program, in that you come to us 3 hours a day for 4 to 5 days a week for about 4 weeks, or we have a partial hospitalization plan. Program where you come to us all day, so 6 hours. You get a little lunch break in there. We serve you lunch, and you come 5 days a week to that, and then you go home at night, get to sleep in your own bed, and then you come to us, and it's about 4 to 5 weeks as well, depending on how you respond to that program. And then the other thing we have that Mel mentioned is TMS. It's transcranial magnetic stimulation, and we have had just fantastic results with TMS. It works along the similar lines as ECT, electroconvulsive therapy, but it's a little less invasive. With ECT, you have to be put under anesthesia. It does have some side effects, some risk of after seizures. TMS, you're awake the whole time. The entire treatment takes about 15 minutes, but you do have to have anywhere from 30 to 35 treatments. We have a lot of people that come on their work breaks or their lunch hour and will come in, have their TMS treatment, and then go back to work. There's really not a lot of side effects to it, and have had great results with it being used to treat depression. And then the FDA is also doing some other studies along with the military to treat PTSD, chemical dependency, anxiety, and then they're also doing some studies on ADHD for use in children, as well as postpartum depression. So it's really worked wonders, because a lot of these people that come in for TMS are your quote unquote kind of lost causes. They've tried everything.
Right.
They've tried different medications. They've tried therapy, and nothing can really get them out of that depression funk. And so a lot of these people come in and have our TMS treatment and really get out of that. And it really kind of clears that fog of depression and allows to get them that normalcy back in their life. And, we have about a 60% response rate. So that means that 60% of the people that come in and get this treatment feel better than they did before they got the treatment. And then we have about 44% of them are in complete remission. They are no longer depressed at all.
That's
So
super.
I mean, just phenomenal statistics. I remember when they came in, the company that makes our chair came in and talked to us about it, and they gave us our numbers. It's like, there's no way. There's
Right.
no way it works that good. You're just giving me your controlled numbers that you found in the lab. And honestly, our numbers that we have in the real world at our hospital have surpassed their numbers.
Well, that's what's so good about it, because you guys take the time to deal with it one-on-one. You're not put in a big group and say, okay, we're going to send you all to this big facility, and there may be 150 people in there, and you all sit there and watch movies and things. But you actually do hands-on with them. What's the typical length of stay that you deal with there?
So for our veterans, sometimes they stay for a 28-day treatment program. A lot of the other patients on open adult can stay shorter stays, maybe like 5 to 7 days,
Yeah,
something like that. On the military unit, we tend to run a 28-day program.
And one thing we want to make clear too is you just don't go out on a limb and start saying, well, I'm going to do this and this and this. You actually work with that individual's doctor, don't you?
Yes, yeah. So we have physicians who work at our facility, and we have what we call treatment team meetings several times a week, so that the physician, the therapist, the nurse can all get together and discuss the patient's care and what's the best approach for them.
And one other question that a lot of people have, they say, okay, all these guys go through all of these problems in the military and everything, and then they transition out and they can't deal with it. But that's not necessarily true. You have females too, don't you?
We absolutely have female patients, yeah.
And while we're talking about that, Mel, are their symptoms the same as the male patients, or are they on a different level or different? How does that work? I mean, a lot of people don't realize that when you're in the military, if you're all doing the same job, you're probably going to act the same. So
Yeah,
is there a
absolutely.
difference between female and male?
There's not too much of a difference. The only difference that we can see is a lot of the time our female active duty military patients may have more issues because of the stress of being a woman in the military.
Wow. That's amazing. That's amazing. What are some of the things that you're going to be doing as we look ahead now? I mean, you guys just don't sit back and say, okay, we got these great statistics now, but you're going to be doing more, aren't you?
Yeah, we're always actively looking for new treatment options. One thing we talked about off the air is one with medications. And just like with medications, therapies work the same way.
Right.
Some work for some people, some don't. So what we want to do is find different treatment modalities that's going to have the best success for that individual patient. What's going to work for them? What's going to help them? Some it's our group therapy approach with some medication management involved in there, and boom, they're good. They're feeling a lot better. Others, depending on their PTSD, their traumatic event that happened, we do EMDR, which is rapid eye movement desensitization. And so Mel can probably talk a little bit more about the clinical aspect of how that works. But it's amazing. And we have other things we can do, prolonged exposure.
Sure.
and things. The issue, I think, that comes with prolonged exposure is you've got to keep talking about that traumatic event over and over and over again. And sometimes that can wear on the patient as well as our staff. And so EMDR, I think, gets a little bit quicker response. But the other things we have is we do art and music therapy, recreational therapy. So, and then we have somebody that comes in, we have them do yoga with them. We have a barber that comes in, gives people haircuts if they need. So, what we're trying to do is one, make you feel better about yourself, and two, find out what's going to help you.
Sure.
I think a lot of times, Mel could probably speak to this. We bring in and we tell our military members, these Navy SEALs, these alpha males, or whoever they may be, you're gonna do yoga today. Yeah, I'm not doing yoga. Are you kidding me? And then, they get out and they do it, and they really like it, and they find the calming sense that yoga teaches them. And they'll come out and they're like, hey, when I get back home, I'm finding a yoga teacher, and I'm going to start going to do yoga and things like that. So, those are really great to hear, and kind of breaking down those walls and finding whatever treatment helps them.
Now, you do a tremendous amount for the veteran, the active duty people. The other part of that equation is when these individuals come to you and they're comfortable enough and they've gone through your programs, what about the family? How are they involved? Because they've got just as big a role to play as what you're doing over there. So how do you work with the family on that?
So a lot of the time we actually do family sessions where we bring in the spouses to sit down and talk with the patient and the therapist as far as the patient's progress in treatment and what things should look like for them going home, how that person can provide support. We also recommend different support groups in our area that they can attend as well. like specifically for our patients who are in chemical dependency programs, we recommend Al-Anon to the family members so that they can process some of what goes along with caring for somebody who has those issues.
Success stories, I know you're proud of those. We got just a few, 2 or 3 minutes left to go. What's the biggest success story you can think of right now, Craig?
You know, one of mine is probably about TMS. When we first started doing it, I had a lady that came in. She had not been sleeping constantly throughout the night for almost 10, 15 years. She came in, she just rolled out of bed in her pajamas, hair's a mess, no makeup on and everything. And, she started doing the TMS treatment. And 2 weeks later, I passed her in the hallway and almost did not recognize her. I had to do a double take, and she, hair was done, was in a full dress, makeup on, and that was one of our biggest success stories. She had not been working that whole time. She was so depressed she could barely get out of bed every day. Had lost her job, had to quit her job, and so now after TMS, she got back out in the workplace, ended up getting a job in a major metropolitan area, paying like 6 figures, and so to me, that's a success story, because how much longer could she have lived like that?
Exactly.
And your quality of life is worth so much. Right. She missed her kids, ballet recitals and sporting events and her personal things that she enjoyed as well. I mean, she was basically just bedridden and isolated in her home. And so now she got that quality of life back and is able to,
that's super. It's got to make you feel good. Mel, quickly, what's your biggest success that you've seen?
I don't think I have any one specific success story. I think the majority of our patients that leave us, though, they come in and they're very isolated. They maybe don't have a lot of trust in the staff or anybody, and they keep to themselves and they're just really down and depressed. And then most of the time, whenever they leave us, we see them much brighter.
That's great. We could go on and on and on and talking about this, but I think we've had a lot of people realize today that they are not alone out there. There is somebody there that's willing to talk to them, and beyond that, willing to listen to what they're feeling. And you guys take the time over there. So as a veteran myself, thank you for what you're doing for the military veterans. Craig Seacrest, Mel Bruce, Emerald Coast Behavioral Center. Again, you're not alone. Go and see these folks.
You're
They'll take care of you.
alone.
All right, that'll do it for this edition of Military Minutes. We'll be back soon again. Have a great day, everyone. I'm Jerry Tabbitt.